My story of inclusion is from my personal experience, which I came across from one of my previous workplace, which is at a early child care center. Please note, I will be not using the real name of the child in this video. In the pre-kinder room of this center, there was a little boy named Andrew, who is a 4 years old child on the autistic spectrum. He's nonverbal and oftenly he avoid eye contact. Even though we talked, he does not show any sign of listening and understanding. He keeps on playing, moving from one area to another area of play corners around the classroom. Andrew's family is grieving over his diagnosed disability. I feel empathy towards Andrew and his family, what they are going through and their hard times. The pre-kinder room has given with an additional educator for inclusion support assigned specifically only to Andrew. He requires support to function in daily life. The additional educator is guiding and looking after him so that the teacher can focus and give her attention to the other children in the classroom and fulfill their requirements. Most of the time, Andrew seems frustrated and fall into attempt to make his feelings and needs known. He gets attention and communicate his needs and wants in verbally by crying only. In these situations, the additional educator is helping him to calm down during his stress triggers, transitions, and meltdowns. I feel empathy towards Andrew as he is having difficulty in communicating his needs and wants with others. Other children in the classroom see Andrew differently than the rest of them, so Andrew is being othered in this situation. They feel difficult and uncomfortable to play with him, and they are confused or frightened by his behavior. He's not interacting with any other children in the classroom, but at times he's injuring them by slapping, which end up making bruises on the other children. The additional educator is helping to resolve conflicts occurring and ensure that there's no any accidents happen to the other children in the classroom because of Andrew's acts and behaviors. I feel empathy towards Andrew's distance from the social connections, developing relationships and friendships with other children in the classroom. The other children are behaving like this mainly because they don't have the in-depth knowledge of Andrew's condition. They are still young to understand the complex health issues, and they are still in the developing stage of their learning, knowledge, skills, and capabilities. According to Victorian Institute of Teaching, teachers provide opportunities for all learners to learn by knowing their learners and how they learn, respecting individual differences and catering to individual abilities. So in this situation, the teacher can explain autism to the children, other children in the classroom, by using age-appropriate, simple and clear language and concepts, avoiding jargon or complex terms. She also can provide examples and real-life situations to help them relate to the concept of autism, and also consider using visual aids such as books about autism for children to enhance their understanding. Andrew hardly participated and engaged in the learning activities in the class as he is uninterested and inattentive. Even though he participated, he kept on disturbing everyone in the group setting. However, he likes to play with Play-Doh and he likes to do painting and art. Apart from that, he loves to dance and listen to music. In these instances, the additional educator is supporting Andrew to engage in activities which he shows interest in. After all, regardless of all the diversity and negativity that is present, the good thing is that Andrew is still included in the classroom, that where he belongs. The center has provided him with an inclusive environment as well as a supportive, additional inclusive, supportive educator equitably. This proves that Andrew's rights and social justice has been fulfilled.